Definitely a beautiful day in Washington, D.C. A little chilly, but otherwise sunny and beautiful. So good morning. I'm Bernie Rosof, Chair of the Roundtable on Health Literacy of the National Academies of Science, Engineering, and Medicine. And I'd like to welcome everybody to today's workshop on integrating oral and general health through health literacy practices. As part of its mission, as you well know, the Roundtable on Health Literacy works to advance the field of health literacy to improve the health and well-being of all people. As one of its major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and issues of concern. One of those issues is oral health literacy. Now, the Roundtable has a very long history of addressing this very important topic. In 2013, the Roundtable convened a workshop on oral health literacy that served as a call to action, as well as exploring state and national activities and additional opportunities to assess oral health literacy. A few people that were at that workshop, by the way, are here today, so welcome back. By the way, we've had wonderful representation on the Roundtable from the dental profession, which has contributed significantly to the dialogue and the recognition of the importance of health literacy in achieving good health and outcomes. It should come as no surprise the importance of dental health in general health. In 2015, members of the Roundtable working with other stakeholders established an action collaborative group on health literacy as a potential pathway to connecting dental health and general health. The purpose of that collaborative was to explore ways in which health literacy principles and practices can help promote effective integration of oral health and general health into an actionable primary care model. General health, dental health, into an actionable primary care model. In 2017, the Oral Health Collaborative commissioned an environmental scan on integration efforts. The resulting paper, Integrating Oral Health, Primary Care, and Health Literacy, Considerations for Health Professional Practice, Education, and Policy, is a comprehensive look at efforts to integrate systems that operate in what the authors call parallel, if not separate, universes. We will be hearing more about that paper later this morning. This workshop is a continuation of the work of the collaborative. As such, it is sponsored not just by the members of the Roundtable, but also by organizations whose support was dedicated to the workshop. They are the American Dental Association, the American Dental Education Association, the American Association for Dental Research, the Health Resources and Services Administration, and the National Institutes of Dental and Craniofacial Research. We would like to thank them and all of our sponsors for their support of this workshop. By the way, this is a fabulous faculty that we have here today. And as I look back at prior workshops, I must say I'm looking forward to this day as much, if not more, than prior workshops. The statement of task instructs us to explore and discuss issues related to the challenges, related to the barriers of integration, the models of integration, as well as effective health literacy strategies of promoting integration. As we continually appreciate the importance of team function in the delivery of quality health care, specifically in the aspects of preventive care, coordination of care, and patient safety, we can immediately grasp the timeliness of integrating oral and general health, and most critically, through the important lens of health literacy practices. The commission paper will enable us to gain a better understanding of the benefits of integration, the critical link to better health, better outcomes, and better value. If we think of the definition of health literacy to include that health literacy occurs where system demands and complexities are aligned with individual skills and abilities, we'll also appreciate the importance of system design or system redesign where appropriate to achieve the integration of oral and general health through health literate practices. As we continue to move to value-based payment, it is critical that we adopt a culture that recognizes that health literacy is key to delivering high-quality, person-centered care, health services, and programs. In the medical care system, as we see it today, the dental care system, and for public health in general, the importance of health literacy is a key factor when we are speaking about person-centered care and involvement of the person and family. In this context, the Joint Commission has stated that the safety of patients cannot be assured without mitigating the negative effects of low health literacy and certainly ineffective communication on patient care. As we think further about the positive aspects of this posture, that is, the positive effects of communicating in a health-literate manner and the value inherent in this posit, I think of the words of Michael Porter. Michael Porter always puts out something that excites me. I think of the words of Michael Porter in an article written for the New England Journal in 1910. Value, neither an abstract ideal nor a code word for cost reduction, should define the framework for performance improvement in healthcare. Value should always be defined around the customer, and in a well-functioning healthcare system, the creation of value for patients should determine the rewards for all other actors in the system. Should determine the rewards for all other actors in the system. The foundational principle that explained the thinking that guides decisions about Health Policy 2030 includes the statement that achieving health and well-being requires eliminating health disparities, achieving health equity, and attaining health literacy. By the way, Healthy People 2030 includes this as its objectives and its framework. So we really have a good decade to be able to accomplish the health literate practices that we're talking about today. I would say that this includes oral health and general health. So we will begin the day by learning more about the commission paper from its lead author, Dr. Catherine Atchison. Then we will have a panel discussion on systems thinking, integration, with health literacy as a catalyst. By the way, I don't want to minimize the importance of Healthy People 2030 having its objectives including health literacy. And we'll hear more about that. The objectives have just been put out for the public use and comment just a couple of days ago. And as we think more about health literacy going forward over the next decade, a lot of the principles embedded in Healthy People 2030 will be obvious. After the break, we will hear from three speakers on various aspects of integration and health literacy, including public health literacy, oral health, and general health, and integration from a patient perspective, and how oral health literacy shapes policymaking. In the afternoon, we have two sessions. The first will look at various pathways to integration. We will hear presentations covering topics on the oral health strategic framework, combined electronic health records, the Kaiser model for integrating oral health and primary care, and delivering preventive oral health services. In our last session of the day, we will hear a panel discussion regarding the future of oral health and primary care integration and developing a research agenda that advances efforts at integration. As always, we have put time aside during the day for discussion, and I think that that is an important part of our day's activities. That discussion between the roundtable members and the presenters and panelists, and from our audience if there is time. And I appreciate comments from the audience as the day moves forward. We have a very full day, so we'll try to keep the introduction brief. If you would like more information on the presenters, on the panelists, and moderators, there is definitely a handout of speakers' bio sketches at the registration table. Also, as always, as we get to the closing part of the day, I'll ask each roundtable member to be noting throughout the day key ideas or key concepts that are brought out in the presentations and the discussion. At the end of the day, as we do at all roundtables, I'll ask each roundtable member to very briefly describe these key highlights, and we'll talk about that as the day progresses. The workshop was organized by a planning committee, and I definitely would like to extend our deep thanks to the members of that committee: Catherine Atchison, Phyllis Beamster-Broker, Susan Fisher-Owens, Nicole Holland, Alice Horowitz, Dashanka Kleinman, Ira Lamster, and Gail Matthey. In addition, I really would like to thank Melissa and Alexis, without whose expertise this meeting could not have happened. It all seems so simple, but let me tell you, it is not. So thank you, Melissa. And Alexis, where art thou? Thank you, Alexis. So I want to remind everybody, as I do at all meetings, this workshop is being webcast and recorded, and we welcome those participants. I'll now introduce our first speaker, Catherine Atchison, and the moderator of the first panel, Dushanka Kleinman. Catherine Atchison holds a professor appointment in the UCLA School of Dentistry's Division of Public Health and Community Dentistry, and is jointly appointed in the UCLA Jonathan and Karen Fielding School of Public Health, Department of Health Policy Management. Dr. Atchison served UCLA as the Vice Provost, New Collaborative Initiatives from 2011 to 2016, and as Vice Provost, Intellectual Property and Industry Relations from 2005 to 2011. From 1998 to 2004, she served as the School of Dentistry's Associate Dean for Research and Knowledge Management. She was also the school, I don't know how you did all this, Catherine. She was the School of Dentistry's Residency Director for Geriatric Dentistry from 2000 to 2006. She is also a Fellow of the American Association for Dental Research. Dr. Atchison is the lead author of the commission paper, Integrating Oral Health, Primary Care, and Health Literacy, Considerations for Health Professional Practice, Education, and Policy. Dushanka Kleinman is the Principal Associate Dean for Research, and Professor, School of Public Health at the University of Maryland at College Park. Prior to this position, Dr. Kleinman completed 28 years of government service, where she served as Deputy Director for the National Institute of Dental and Craniofacial Research at the NIH, and Assistant Surgeon General, Rear Admiral at that time, the United States Public Health Service Commission Corps. Dr. Kleinman is a diplomat of the American Board of Dental Public Health and has served as President of the American Board of Dental Public Health, American Association of Women Dentists, and the American Association of Public Health Dentistry. Currently, she is the co-chair of the HHS Secretary's Advisory Committee on National Health Promotion and Disease Prevention Objectives for 2030, similarly to what I discussed earlier in this talk. So, Dr. Atchison, let's begin.